Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Pulmonary hypertension, you're looking at the classification as well as the causes. So based on their mechanisms, it is divided and it is as per the WHO. And the group 1, so there is group 1. So group 1 means it is the pulmonary artery hypertension. So what are the causes of this? Causes, it can be idiopathic. Next is it can be due to the hereditary PAH. So hereditary PAH is nothing but the BMPR2 gene. So BMPR2 gene is nothing but the MC, that is the most common type of mutation. Next, the cause, it can be due to the toxin or drug induced PAH. So it can be drug or toxin induced PAH, and there can also be, we are talking with respect to type 1, group 1, that is, it can be associated with the connective tissue disorder, CTD, and it is limited to systemic sclerosis. Next, they can be associated with the portal hypertension, the HIV, as well as the schistosomiasis. Next, we move on to the other types such as the pH long-term responders to the calcium, pH with a long-term, so who have long-term response to the calcium channel blockers. Next is the pH with overt features of pulmonary veno occlusion and occlusive disease, or the pulmonary capillary hemangiomatosis or the pulmonary capillary hemangiomatosis. Next, it also includes the persistent pulmonary hypertension of a newborn syndrome. The persistent pulmonary hypertension, this is of a newborn syndrome. Now let's move on to the group 2. So here in group 2, it has the pulmonary hypertension, PTH associated with the left heart disease. We are writing it as LHD. So this cause, it may be due to the left ventricular systole or the diastole dysfunction. Next, it can include the valvular heart disease as well as the congenital cardiomyopathies. Then we move on to the group 3. Here in group 3, it includes the pulmonary hypertension, that is the PHTN, and it is associated with the lung disease. So it is associated with the lung disease. So what are the causes? Causes can be COPD. So it is COPD, it can be due to the interstitial lung diseases as well as sleep disordered breathing. So sleep disordered breathing. Next is what it includes is alveolar hypertension disorders. Alveolar hypertension disorders, chronic exposure. This is to the high altitude. So alveolar hypertension, chronic exposure to high altitude, as well as the developmental lung disorders. So group 3 is associated with lung diseases such as COPD, interstitial lung disease, sleep breathing disorder, then alveolar hypertension, chronic exposure to high altitude, as well as the developmental lung disorders. Next, we move on to the group 4. Group 4 means that the chronic thromboembolic pulmonary hypertension. So it is chronic thromboembolic pulmonary hypertension. So in this variety, the causes, it includes the chronic thromboembolic pulmonary hypertension. Next, it also includes the congenital pulmonary artery stenosis. Then comes the pulmonary arteritis as well as the pulmonary angiosarcoma. So this was about group 4. Lastly, we move on to the group 5. So here in the group 5, what do we have? In group 5, there is a pulmonary hypertension, so PHTN, and this is along with the unclear. So you have pulmonary hypertension and you have an unclear or multifactorial mechanism. Multifactorial mechanisms. So what are the components? What are the causes? It can be due to the hematological causes. So that is a chronic hemolytic anemias. Next is the metabolic disorders. Metabolic disorders such as the glycogen storage disorders. Then the systemic disorders such as the sarcoidosis and other disorders such as the tumor. If there is tumor obstruction, there is fibrosing mediastinitis. To learn and grow daily like this, please do subscribe.